Hello everyone. In this video we are going to discuss divide and conquer technique of phacoemulsification. So divide and conquer is a fundamental cataract removal technique in which we mechanically disassemble the nucleus by sculpting grooves with a phaco probe. This is followed by cracking the nucleus into 4 distinct quadrants which are then individually emulsified and aspirated from the eye. The steps of divide and conquer include initially making a small groove or trench, followed by rotation of the nucleus by 90 degrees and making another trench perpendicular to it. This is followed by cracking first into 2 heminuclei which are then further divided into 4 quadrants which are then individually emulsified and aspirated from the eye. So let's now see a demonstration of this technique in a real patient. The initial steps like keratome incision, side port incision and continuous curvilinear capsule rhexis are performed in a routine manner, and after hydrodissection and nucleus rotation, phacoemulsification is started. So first we will make an initial groove confined within the rhexis margin. For this, in phaco 1 position or sculpt mode, 10 initial longitudinal trench is fashioned in one direction. The end point is at which we see enhancement of the red reflex. Subsequently, the nucleus is rotated 90 degrees and another trench of adequate depth is made, giving it a cross-shaped appearance. Then we proceed to cracking or fracturing the nucleus. For this, 2 instruments are placed in the bottom of the groove, and in a lateral motion, the nucleus is first fractured into 2 heminuclei which are then further divided into 4 quadrants. Then we proceed to phacoemulsification, in which each quadrant is individually first brought into the center and then phacoemulsified and aspirated from the eye. The good thing about this technique is once the nucleus is divided into 4 quadrants, one can take his or her own time to safely bring the nuclear fragments into position and then phacoemulsify and aspirate from the eye. So after nucleus removal, cortical aspiration and irrigation is done in routine, and this is followed by IOR implantation. Viscoelastic is aspirated, the corneal incisions are hydrated and the case is closed. So the advantages of divide and conquer technique include: it is a highly forgiving procedure, so it is very suitable for the beginners due to its stepwise approach. It facilitates safe division of the nucleus into smaller manageable quadrants. It provides good control and stability during nucleus management by reducing stress on the zonules and the posterior capsule, and it works very well for a wide variety of cataracts including the very hard ones. The disadvantages of this technique include longer time than the other nucleotomy techniques. Also, it requires adequate pupil dilatation and good visualization for safe trench creation. Deep trenching, especially in softer cataracts, run the risk of posterior capsule rupture and punch hole, especially in the beginning of your careers. Also, divide and conquer requires more cumulative ultrasound energy and longer phaco time than the job techniques, so there is an increased risk of endothelial cell loss. Thank you very much for your attention.